Absolutely, because food is not just nutrition. Food is information. Food is information for our cells as to what to do. It's information for our genes, how to manifest, like what our epigenetics should be. So I just think we have the wrong paradigm about food so many times. It's a calorie is not just a calorie. It's so much more than that.
Welcome to the Too Curious MD Podcast. I'm Dr. Ali Ahmed.
And I'm Dr. Soraya Ahmad.
In this podcast, we are asking the unasked questions.
We're physicians applying the lens of narrative medicine, exploring integrative practices and psychedelic treatment in healthcare.
Together with our guests, we weave new learnings from stories, expertise, and the sciences. With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in. Welcome to the Too Curious MD Podcast. I'm Dr. Ali Ahmed. And today I'm here with Dr. Monica Jauregui. She is a hospitalist, former internal medicine doctor. She'll be speaking to us. And we are going to be asking the unasked questions. In this podcast, we are applying the lens of narrative medicine, exploring integrative practices and psychedelic treatments in healthcare. And with our guests, we really want to weave in new learnings from stories, expertise, and the sciences with the wisdom from holistic, alternative, and conventional medicine. And we're here to challenge the status quo. So we'll be asking those questions and want to remain curious to what we are learning in the art and science of healing. So welcome, Monica. I'd like to just introduce you just so that our listeners and viewers have some background about you. Welcome to our show. And today, I have the pleasure of speaking with you. You are a board-certified internal medicine doctor, hospitalist doctor as well, with expertise in functional and integrative medicine. Originally from Monterrey, Mexico, you graduated top of your class from the Institute, I'm going to say this wrong, and then came in and did your internal medicine training in Louisiana State University at Shreveport. You began your career as a hospital medicine physician, working with critically ill patients in East Texas in the ICU, and in 2019 had expanded your focus to functional medicine and trained in the Institute for Functional Medicine, International Lyme and Associated Disease Society. You belong to A4M and Kalish Institute. You also founded Salud Optima in Texas, I believe, a practice dedicated to holistic lifestyle medicine for Hispanic community in Texas. And you've launched now your practice called Truly Healthy MD in the Bay Area, where you are specializing in complex and chronic medical cases for patients who have struggled to find answers elsewhere. And often you're called a medical detective by your patients. And I can definitely resonate with that because it is about, really digging in and discovering what is going on sometimes, but applying that compassionate and investigative approach to medicine. Beyond your clinical work, you're also a founding board member of the College of Integrative and Functional Medicine Physicians, where you're leading the education committee and working to bridge the gap between conventional and functional medicine. So welcome to our podcast. Thank you for being here.
Thanks. It's my pleasure to be here.
So as we begin, I'm really curious about your journey into functional medicine. How did that begin, and what is it like for you right now from your journey in conventional medicine as a hospitalist to now the work that you're doing, especially in the complex patients that you take care of? What is that like for you?
Yeah, thanks for asking. I think that's always a great question to get to know a doctor also as a person, as a healer. We're more than just our academic background, right?
Yeah.
So as you told our listeners, I'm bicultural. I grew up part of my time in Monterrey, Mexico. I also lived in Dallas, in Florida, in Puerto Rico when I was growing up. So, I had a little bit of a diverse background. I have dual citizenship. I'm obviously fluent in Spanish. I went to medical school in Mexico, then finished up my training here in the US as an internal medicine doctor. I've always known a lot about natural healing because my mother is a nutritionist. She studied nutrition at Cornell and then went on to do a lot of studies in the integrative field in functional nutrition. We always had books in our house about Dr. Andrew Weil. We always cooked in our home in a way that helped heal us. So that's where I was first learned about how to heal in more than just what I learned in medical school. So that started at a very young age. And then I did go to medical school wanting to help people heal. I love being an internist. I love being an MD. I'm first and foremost a medical doctor and internist, and then I feel like I can help my patients a lot more ever since I did start integrating all these, a wider toolbox with integrative medicine. I was a hospitalist from 2011 to 2019 in Tyler, Texas. And towards the end of that time, I was just really feeling like I was not helping patients the way I thought I would when I was in medical school. I felt like my patients just kept coming back. I would discharge them and have these great plans of them going home and taking care of themselves, but then they were back in the ER the next month. And it was, I was starting to suffer from burnout as a physician and just really not feeling like I was helping patients as much as I could. I decided to leave my hospitalist job in late 2019. So, right before we got to COVID. So I guess that was kind of in part, we obviously didn't know COVID was coming when I left that. But right after I left, my colleagues were there in the hospital and had to see a lot of terrible things with all the suffering that we had in the peak of the pandemic, but I had already made the decision to leave. So I didn't go back. I started studying at IFM. I got certified through IFM and I started my first practice, which was my integrative practice for the Hispanic population of East Texas called Salud Optima, where I started teaching them what I was learning at IFM. I wasn't fully certified when I started my first practice, so I was kind of like just diving head first. I was like, okay, I'm gonna bring what I'm learning to my Hispanic community, and they were very, very accepting of it. I had more than 1,000 patients in the first year or two of opening that practice, and in general, it's a very culturally accepted thing to want to heal more naturally in the Hispanic community. I feel like in this country, we do have a kind of like a pill for every ill sort of mindset sometimes. And I'm not saying that I don't have so many amazing patients that don't have that mindset, but in general, it is a little bit culturally different. So it was a great place to start my integrative journey with those patients in the Hispanic community. And so Salud Optima was a resounding success. We got a lot of people off their diabetes medication, off their blood pressure medication, just feeling better, being more productive by teaching them the basics of functional medicine, which is really if you sleep better, eat better, manage your stress better, you're just going to be a lot healthier. You don't necessarily need to be taking a ton of supplements. That's not what integrative or functional medicine is. It's taking care of your health and healing from a root cause. So as you also said in my introduction, I now have a Truly Healthy MD, which is a practice where I am seeing a lot more, patients with a lot more problems than I was at my first practice. My first practice, I was mostly seeing people with diabetes, hypertension, those typical things. When I decided to go for training to become a Lyme literate doctor and a mold literate doctor through ILADS, through several mentorships, including that with Neil Nathan, I started, developing a reputation for a doctor that could heal these very difficult to heal things. And so those are the patients that are mostly seeking me out at this point, although that's not all that I do. I have a lot of passion for other things. I also have a passion for functional dermatology. So people with things like as simple as maybe acne, that they don't want to be on Accutane, they want a more natural approach, they can find that with me. I have, interest in the gut and hormones. I prescribe bioidentical hormones. I help people find the root cause of their IBS, fibromyalgia, and help them heal from that. So I have an extremely, extremely diverse practice at this time.
Yeah. Well, it sounds fascinating and quite a colorful array of different conditions. Some of the things that I ask patients is in narrative medicine is those questions that sometimes we don't ask in our training, right? Is the typical, we ask kind of the typical question of like, what is abdominal pain? Describe your abdominal pain. When does it get worse? When does it get better? What are the triggers? What do you do for it? What works? What doesn't work? And there's a kind of a checklist of things. One of the things that I think really opens up a conversation in what really is maybe the condition of abdominal pain, which is not a diagnosis, it's just a symptom. But what is your approach for being that detective in a patient who presents to you? How do you approach their condition? And
yeah, so I think the first step is really getting them to know as a human, getting to know them as a human being. People aren't just a conglomerate of diagnoses. We have to, as medical professionals, find a diagnosis to put in their chart, but they're really more than that. And a lot of the diagnoses we use aren't true conditions. For example, IBS, that doesn't really mean anything from a root cause perspective. It just means they have those symptoms. And so, number one, getting to know the person, who they are in many ways. What brings joy to their life? What goals they have for the future? Their likes or dislikes. A lot of times, I will give nutritional recommendations, but if I don't already know what kind of food they like to eat, then it's going to be really hard to help them heal with healthy food. I can't just tell them, oh, hey, you shouldn't eat gluten and figure it out, right? So if I ask them what they're eating right now, from the foods they're eating to, are they eating with family members? Do you cook just for yourself? Are you also cooking for your spouse? Kids at home? Learning all those things is the very, very first step I need to do in order to come up with a plan. Number two, I have to figure out what their main symptoms are and really have a good framework for figuring out the root causes for those symptoms. As far as what I bring to patients from a conventional medicine standpoint, we all know that there's a gazillion drugs out there, medications that are great. I'm glad they're out there, that they control symptoms. If somebody comes to me with depression, by all means, I can put them on an antidepressant. I'm not against it. I just don't stop there. I say, I offer an antidepressant. If they don't want it, fine. If they want it, great. Let's put you on it. But let's not plan on you being on this long term. Let's plan on figuring out why you have this symptom. You are not a person that should be defined by your depression. You are so much more than that. So let's not say you're, a depression person. You are a person who is currently suffering with that symptom, and we're going to find the root cause. Root causes of symptoms that we have are usually many. The human body has an amazing, amazing ability to heal and to recover. And so by the time people come to a physician with a symptom, it's usually at least 3 or 4 things that have gone wrong. And so I can't just say, oh, hey, I found one thing, that's it. I have to look at them really, really holistically and try to peel away. Sometimes I use the metaphor of peeling away the layers of the onion. Sometimes, we found one root cause, but you know what? We're going to treat that, but we're going to keep looking. There's probably 3 or 4 root causes that are also behind that. And it's probably different things. Some of that might be trauma. I have to talk to them about their childhood and any traumatic experiences they might have had, or even as an adult. Those traumas really can make us sick, and we need to address those. I needed to, look into if they have what their total toxic burden is. We're all living in a very toxic environment, and so we all have some amount of buildup of those things in our body. I'm talking about things like glyphosate, because nobody eats a completely organic diet. I'm talking about heavy metal toxicity. Obviously, we want our patients to be eating fish, but unfortunately, fish come with heavy metals. So most of us have a little extra mercury that we shouldn't be having in our bodies. Also, total toxic burden comes from our cosmetics, from how we clean our home. It comes from chronic infections. A lot of people are harboring a lot of microorganisms that they didn't know they had. Things like chronic Lyme disease, which is not something that is conventionally thought of as a real condition. They think it's just a thing that people hear about on social media is not real, but we have scientific evidence now that chronic Lyme disease is a real thing. And when these people are treated with the right antibiotics, be pharmaceutical or nutraceutical, they get better. So it's not just the placebo effect. We know and we find on labs that they have chronic infections when we treat them with these antibiotics and we heal their body from the ground up. They do get better. So
what do you find is happening right now in our environment that you mentioned, pesticides, you mentioned, unregulated sometimes makeup, and the industry of beauty industry and, the chemicals that we're surrounded by. But what do you think is really happening and, in terms of our nutrition that you feel makes it something that we can really address in simple ways, as you spoke about with your early work in Texas, addressing their diabetes. I think it's important to kind of for the audience to know that there are things that are happening in our environment, and what are they? But what are the simple things that we can do to address those?
Yeah, and that's something that I'm glad you brought up. Sometimes I get carried away talking about, okay, these are the root causes, and people are like, okay, but what can I do now to make my health better? And yeah, nutrition is one of those cornerstone things. We do need to be aware of what kinds of foods are going to help us heal, whether you're already a person that's struggling with symptoms, or you're a person that's healthy and wants to stay healthy, or you're a mom or a dad and wants to feed your kids in a healthy way. These are some really, really cornerstone things that I'm glad you brought that up so we can have more awareness. And I think a lot of what's happening these days is that we live in too fast of a society. And so we want to be having foods that are easy to access. So we buy processed foods or we eat fast food. And unfortunately, even if you're reading labels, most processed food is just not going to be nutritious food. I guess the number one thing you can do is eat things that don't come with labels. Go to your produce department, go to the meat section and find good quality grass-fed beef and wild-caught salmon. And if you just do that, that is going to do so much more for your nutritional status. Our bodies, like I said earlier, are primed, are meant to heal. And that only happens when we give them the nutrients. Every cell that's currently in your body was made from something that you ate, right? It's not, obviously you were born at some point in your life, but you don't have any of those cells in your body anymore. Everything, every molecule in your body is something that you ate. So making those good decisions is going to make a healthy body.
They say even the iron in your cells, the iron came from a bigger place, like the Great Big Bang. Iron kind of is in the atmosphere and enters into our planetary system, and it came from another place. So a lot of the times we're so there's lots of discussion about heavy metals coming from another place that again enter into our bodies and naturally and necessarily. And then generationally, right, when we have there's an effect of trauma, and this is what we witness in my work, is the epigenetic effect of nutrition, food access. I come from an environment where, countries where we were normally starved, right? Relatively starved. Food was not accessible. You ate once a day and you worked hard. And then, of course, when, we're now living in a fast-paced, technologically, access to food is readily there. And then you eat that food, and what happens? Your body, again, doesn't know it's not in a starved state anymore, but isn't able to handle that nutritionally dense food, and thus we get diabetes.
Yeah, absolutely. Because food is not just nutrition. Food is information. Food is information for our cells as to what to do. It's information for our genes, how to manifest, like what our epigenetics should be. So I just think we have the wrong paradigm about food so many times. A calorie is not just a calorie. It's so much more than that.
Yeah, and I think in our medical school training, we were always told, certain populations had a higher risk of diabetes. It was a genetic thing, but it really is more of an environmental effect of genes than it is a genetic. There's no gene for, say, obesity. It's really an effect on the gene that, somebody develops obesity from.
Absolutely.
So it's kind of
Exactly.
the understanding of conditions, for me has really changed. We've opened up that whole idea of it's a genetic condition. Cancer is a genetic condition, and cancer, is a metabolic condition. Something
Absolutely.
happens that triggers that metabolic dysregulation.
Yeah.
And
Yeah. Yeah, and so, speaking about that, I also have a little bit of training in integrative oncology, and so I have studied with Dr. Nasha Winters. She has the Metabolic Institute of where she teaches people how to integrate a more healing approach to their cancer treatment. Obviously, she supports people going to their traditional medical oncologist, but she says in conjunction to that, there is so much that we can do to support people in their cancer healing journey. And yeah, it's a metabolic disease. That's what her institute's called. It's a metabolic institute. So it is a metabolic disease.
yeah, and some of the ways I think I've been reading, and I'm curious to know your opinion on an approach for treating a cancer before chemo. Some of the studies that I've been reading to talk about preparing the body not nutritionally but actually in deficit, really putting the body in a ketogenic state before chemo, so that when the chemo, because the cells, the cancerous cells are more prone to, kill rate is higher post chemo when
Yeah.
they've been exposed to a starved state, and then you get a better response for your chemo treatment. What is your opinion on that approach, and in similar conditions where you would take a metabolic approach before treatment, say?
Absolutely. Yeah. And so it's a complex topic. We definitely can't talk about all of it. And this is definitely not meant to be medical advice. So if you have cancer, don't just go on a keto diet and expect your chemo to work better. It's not that easy. The keto diet is great for some people who are suffering from cancer. It will make your cancer treatment go a lot better because cancer feeds on sugar. And so for some people, going into doing a keto diet and going into ketosis does help kill those cancer cells, but it's tricky. You cannot do it. You must not do it if you're not working with a qualified health professional, because unfortunately, if you don't do keto right, it's worse. You get malnourished. And if you talk to an oncologist, most oncologists really hate keto diets because patients don't do it right. Their patients are malnourished. And if you go into a chemo treatment malnourished, your likelihood of surviving this cancer is going to be a lot worse. So it's a great topic to learn about if you have cancer, but don't try to do it on your own.
Yeah.
And going back to the genetics, what I've learned with Dr. Winters about how to approach a person who needs chemo and counseling them on their diet is that I need to understand a little bit more about their genetics first, because we are all going to have a different genetic predisposition as to which diet is going to be the best for us. Some people do very poorly on keto diets, and a lot of that we can figure out with genetic studies. So yeah, we do a lot of genetic studies when we are trying to help people figure out how to best prepare their bodies for chemo. But yeah, absolutely. The less sugar you eat, the less your cancer can grow, for sure.
Yeah.
For sure.
And even in depression and anxiety, sugar is an inflammatory agent that does stress the body and keep that stress state in a higher activation sensitivity too to environmental effects.
Absolutely, yeah. And I know you studied nutritional psychiatry, right? So you probably know this better than I do, but it's absolutely true that depression is an inflammatory state. It's not just in people's head. There's something going on in the brain that's causing them to have this symptom, but it's really a metabolic inflammatory condition.
Yeah. Yeah, I'm fascinated to, the sciences bringing in integrative and functional, and you've done both, you've done the integrative and functional approach. Tell our audience, what would be an integrative approach and functional approach, because there's a lot of, even among conventional providers, understanding that.
Absolutely. I think understanding what each of those things means is super important. So sometimes we'll use the term functional and integrative a little bit interchangeably, but they're really not the same thing. So just to clear things up, the only thing functional medicine actually means, it just means that we're getting to root causes. It does not mean that you're going to go to a functional medicine doctor and they're going to just treat you with herbs or supplements instead of your medications. Yes, functional medicine doctors know a ton more about herbs and supplements than before we studied functional medicine, but functional medicine exclusively means root cause medicine. And it's annoying to me that if somebody goes on Wikipedia and they put, what is functional medicine? It says functional medicine is a pseudoscience, and they try to load you up with unnecessary labs and supplements you don't need. That is very false. Wikipedia is completely wrong. I don't know why Wikipedia refuses to change their entry, but functional medicine only means root cause approach. There's a lot of medical doctors out there that practice functional medicine without knowing it, because they really dive deep to figure out what is causing the symptoms and not just put a Band-Aid on it. But they don't call it functional medicine, but that's all it is. When we go to functional medicine training, I did mine through both A4M and IFM, but there's a lot of other places where people can get functional medicine training. Yeah, I learned about nutrition, sleep, botanicals, nutraceuticals, vitamins, because it helps us treat people once we find the root cause. And so they really do teach us integrative medicine. Now, what is integrative medicine? Integrative medicine is not the same as functional medicine. Just because you practice integrative medicine does not mean that you're actually looking for root causes. You should be, but there's a lot of integrative medicine doctors that just, in addition to treating people with pharmaceuticals, they know that nutraceuticals will work too, right? So let's say, again, something that you know better than I do, depression. If you go to a doctor and the doctor tells you, hey, you can either take Zoloft or St. John's wort, which do you prefer? That doctor is practicing integrative medicine, because they are integrating more things than just what they teach us in medical school. They're not practicing functional medicine because they're not asking the patient, why are you depressed? So it's best to go to somebody that does both integrative and functional medicine, but they actually, because they have overlaps, but they're not the same thing.
And I describe it in terms of the more of the holistic approach, the other alternatives to healing, red sauna, or cold plunging or acupuncture, and kind of building in those elements to pain, say, or to sleep,
Just to circle back to that, I didn't mean to say that integrative doctors just also did nutraceuticals and other pills. An integrative doctor may actually not know anything about how to use an herb or a supplement, and they only know about how to use, some of the modalities that you mentioned, red light therapy, or, things that are not more pills. There's so many healing modalities that are not more pills. And if a doctor has included in their toolbox other healing modalities that aren't just pharmaceuticals, then they are by definition an integrative doctor, whether they call themselves that or not.
Yeah. As a person who feels very strongly about, being a detective or, for patients and really being compassionate, what do you feel is missing currently in the system of healthcare right now, and in terms of what you see in patients and why they would come to you?
So I think
it's a two-part question. So.
Yeah. I'll try to answer it the best I can, and you might have to remind me what the other part of the question was if I don't answer it fully. But I think it's no secret that our healthcare system is broken, that people are paying a lot for their insurance. They're not getting the treatments they need. Doctors have to do prior authorizations and all these medicines that are obviously medically necessary. And so there's so many things that are wrong with our health system. And it's not just one thing. It's not just how our health insurance companies work. It's not only that our studies are based on what Big Pharma supports. It's not only that in conventional medical schools, they should be teaching us more about nutrition and about lifestyle. It's all of those things. And unfortunately, all of those things together are just making our patient population not get the care that they need when they go to a conventional doctor. And by all means, I love conventional doctors. I know that they're doing the best they can with the limits that they have, with the education they got, with the way that they have to practice with healthcare insurance. We only get a few minutes with a patient when we have healthcare insurance. We can't get them all the medications they need because insurance companies just won't pay for them. So by all means, to people listening, I love conventional medicine. I want it to continue to grow and be better. It offers so much. You need to keep your doctors, but we need to have more awareness that needs to revolutionize. And the faster it does that, the better outcomes we're going to have for our health population. It's ridiculous that we have so much lower life expectancy than Japan. People in Japan live 10 years longer than we do. And that's just mind blowing. It's ridiculous. We are just as advanced of a society as Japan, but we have much more. I don't really know the statistics, but I am pretty sure last time I read them, we have, we die younger. We have more infant mortality. We have more pregnancy complications. People are just, again, I don't know, I haven't researched this recently, but if people have, just poor health in general, more obesity, I imagine, than in Japan. And it's not because the Japanese people are just super blessed with amazing genes. You bring a person with Japanese genes to to the US and they will also get sick. So it's multifactorial. Yes, there are some things that people with Japanese genes are going to be more and less predisposed to, but it's not just the genes.
Yeah. So
what was the other part of the question?
that was wonderful. I think that's really does highlight some of the things that we're seeing and why patients do seek out other alternatives. They're really seeking out an answer that really resonates with their experience, and as well as when you with your own experiences, as you mentioned earlier, with the burnout is real, and it is a institutional problem right now, I think, or we're seeing. And so, I think you spoke earlier about, your own background and journey into functional medicine really came from a deeply personal experience too, right? Knowing that there are other alternatives to healing, from your mother's experience and your own experience in nature, and addressing that early in life, and seeing that is a need that's still missing. I think where there's a lot of talk about our younger population is also not exposed to nature and not exposed to the outdoors. Vitamin D deficiency is low, and this is a global issue as well. Food is readily available, and sugar is in everything. And
Oh yeah, absolutely.
it's hard to school lunches, things like that. And of course, these are bigger topics, but I appreciate the work that you're doing, and I think as a community of providers, I think what would you say to your colleagues now with what you've learned in your practice and what you're seeing now? What would be a message that you'd like to share?
You mean to my conventional medical colleagues that are still stuck in mainstream? The number one message is that doctors need to admit that if they're unhappy with their practice, it's okay. They can admit it, and there are alternatives. They sometimes feel like they have to be stuck in because it's the only thing they know. And so if you're unhappy, please know that the way you're practicing is not the only way to practice. There are so many things out there. And you don't have to do what I did. You don't have to do functional medicine. You don't have to do integrative medicine. There's so many other things that you can do that may fulfill you a lot more. I personally feel like functional integrative medicine is, obviously the path that I chose, and it makes me very happy, very fulfilled. I can help people actually heal a lot more than I could in the past. I thank every doctor for the heart they have in what they do. It's hard. It's hard being any doctor,
Yeah.
even if you're just doing conventional medicine and you're just, doing the same thing day after day. It's hard. It's hard being a doctor. And I also want my conventional colleagues or people who only practice conventional medicine, because I'm a conventional doctor too, right? But
Yeah.
people who don't understand what functional and integrative medicine is, those people who think that it's not evidence-based, I want you to really, really understand that everything we do in functional and integrative medicine is evidence-based. No, it may not be the same studies that you're reading, because you may only be reading studies that are promoted by big pharma companies or by academic institutions who have limitations in the type of research they can do. The evidence that we're using in functional medicine sometimes has to come from other literature. I have to learn from the veterinary literature. I have to learn from the naturopathic literature. I have to learn from people who are PhDs who sometimes they don't know that they're making advancements in science that are helping medicine, but I can take their research and I can integrate it into my practice. And I can practice more personalized and cutting edge medicine that's every much, or if not more, evidence-based than what is done in conventional medicine. And they actually say that it's a well-known fact that when research is published, it takes about 50 to 20 years to actually change the guidelines. And so we know this. We know this as conventional doctors. We have to go by the guidelines because they're the guidelines. And so, I don't practice guideline-based medicine with everything. I follow guidelines, but then I take the newest research and I implement that and I personalize it for my patients. And that's what gives me really good results.
Yeah, and you're right. You mentioned the personalized approach. I think really that really connects to what patients need, is to be seen and heard, and to know that there's, it's not about us prescribing, it's about really empowering what they need and recognizing that. I think that's important.
Absolutely. Yeah, I've heard a lot of stories of patients that they were waiting to get in to see a functional medicine doctor. They had a long wait, and in the meanwhile, they started just reading up on stuff, listening to podcasts, reading books on how to take better care of themselves. And by the time they got to see the functional medicine doctor, they were already 80% better, and they actually didn't need that much work with a functional medicine doctor. So patients should become more empowered to take care of their health. I always tell patients that ideally you'll be working both with a functional medicine doctor and a health coach, but if you can't afford both, go get a health coach. A health coach can help you learn how to eat better, exercise better, manage your stress, sleep better. And once you do those 4 things, you're not going to need to invest as much money in a functional medicine doctor because, unfortunately, functional medicine doctors cannot work under insurance most of the time. We just don't get paid for the work we do. So if you can't afford a functional medicine doctor, yes, save up, but in the interim, go find yourself a health coach. That's the first step.
Yeah. Well, thank you for sharing your story and your work. And sounds like you're really doing the things that you really believe in and trust in. And I think that's a really powerful place for patients to have that, somebody who has the knowledge and the experience, the personal experience, as well as the education and training that you've applied in your work. So thank you for.
Yeah, it's great to be here and to share these things, because I do want to be a messenger of hope and healing for all our listeners out there. I know I won't be able to be the doctor for most people who listen to this, or maybe any of them, but if I can change your lives just a little bit by these messages, I hope it's a positive thing in your life.
Yeah, thank you.
Thanks for joining us on the Too Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.